All righty, we are going to get started. And we are moving on ahead with what we know about COVID-19 and planning for the future. My name is Dr. Valda Crowder, and I am, most folks just call me Dr. V. For those of you who haven't been on this webinar before, I'm an emergency medicine physician. I've been doing this now for 30 years. You can follow me on Twitter at AskDrV. It's the same handle for Instagram. And also the source documents for this presentation are on my website at AskDrV.us. These presentations are also on the website and on YouTube, and all of them are dated. So that way you know whether or not you're getting the latest, most accurate information. So this is a presentation today for September 22nd, 2020, and we do this every Tuesday and Thursday between 8 and 9 p.m. All right, so the structure is that we're going to have a slide presentation for 10-15 minutes. Sometimes it's a little bit longer, sometimes it's a little bit shorter, followed by Q&A. Normally, this is 45 minutes to an hour, and we normally complete sometime between 8:45 and 9 o'clock. Everyone is in listen mode on the presentation. If you want to ask a question, you can put it in the chat icon, or you can also put it in the Q&A. You ask people, if you have questions or you think of questions during the week, you can feel free to email me. There's a comment page, or you can send a notice even on the website. And I will include slides in the upcoming presentation to actually answer the question that you have. The intention of this webinar is to keep participants informed with COVID-19 science that will help them and their families stay healthy during this pandemic. The outcome is that you leave motivated to create or adjust an action plan for yourself and your family. And for some people, you're creating or adjusting an action plan for a broader community, like a school or a union or a homeowners association or a workplace. Just a little bit, a pandemic is any sort of worldwide spread of a new disease. The disease must be infectious or contagious. So it does not include, for instance, a new type of cancer or something like that. So it must be an infectious disease that people do not have immunity to. There's been several types of pandemics: smallpox, polio, tuberculosis, HIV, bird flu, SARS, MERS, malaria, Zika. These are all examples of pandemics. This week, we actually passed a milestone in the United States of 200,000 people dead. This is very unfortunate. If we had a death rate that was like our partner to the north in Canada, there would be about 100,000 people that would still be with their friends and family. We are seeing signs that COVID-19 may have hit the United States as early as December. They're now retrospectively going back and looking at hospital visits for respiratory-like symptoms and hospital admissions. And it looks like there were signs of this as early as December. This is the importance of having a real-time early detection system, because you don't want to know now that you had COVID-19 in December. We would have liked to have known in December that COVID-19 had hit our shores. Dr. Fauci has recommended that these 7 states actually go on a stronger lockdown: North Dakota, South Dakota, Iowa, Arkansas, Missouri, Indiana, and Illinois. There's sort of alarming rates of growth of COVID-19 in these 7 states. Now, this is interesting. What they did was they looked at people who have COVID-19. Where had they been in the last week or two prior to their infection? So the 3 top areas that people had been to were bars, restaurants, and gyms. So this is very, very important: bars, restaurants, and gyms. So as you go into the wintertime, and until you get vaccinated, you really, really want to stay away from these 3 areas. The other areas where you're seeing outbreaks are churches, whether or not it's funerals or weddings or regular church service, and also airplane flight. Now, the news has gotten really crazy around COVID-19, and I just put up some of these ads that, they had taxpayer money that was meant for swabs and masks that instead went to jet engine parts. Then RFK's grandson somehow or another became part of Jared Kushner's COVID-19 task force. I guess they were hiring young kids, 23, 24 years old, having them work for free, and then wanting them to create models that made it look like there would only be a maximum of 80 or 90,000 people dead. These kids had no experience creating models. This person, Max Kennedy, Robert F. Kennedy's grandson, actually said he didn't and quit the task force and then became a whistleblower. There was also some conversation last time about COVID-19 liability protections. And so I'm actually going through this documentation now on what are some of the liability protections. Right now, it seems to primarily be liability protections related to claims regarding COVID-19 and who brought them in contact with each other under a specific set of circumstances. But we're also seeing states begin to create liability protection at different levels. I know there's been a lot of talk on this conversation about, can we trust the information from the CDC? We've seen recently definitive information that their communications were actually being altered from what the scientists put together. And we're seeing certain things occur and then be reversed. One of the main things that I saw was when the CDC actually said that if you were in contact with someone with COVID-19, you didn't need testing. That didn't make any sense. And they reversed that decision and then reversed it again. And then also similarly with the risk for coronavirus as far as being aerosol or airborne. So what you want to know when you see this information reversing like this, whatever you see that actually shows that, whatever evidence you're seeing that actually shows that the disease is more dangerous, that is most likely the accurate information. So asymptomatic people who had COVID-19, should they get tested or should they not get tested? They should get tested. CDC acknowledging the risk of coronavirus as an aerosol, and then they reverse course. No, it can be aerosolized. So both of these things we've actually discussed on this presentation. So I want to make sure that, because there's this manipulation of information in science that's coming out of the CDC, that you realize that the more serious warnings that you actually get are the accurate warnings. Now, the other thing that's happening, and this relates to Ruth Bader Ginsburg, Obamacare, and the pandemic. Obamacare requires insurance companies to provide vaccines for preventative care for free. That would include a coronavirus vaccine. Currently, there are 21 million Americans that are insured by Obamacare. There's a Supreme Court case that's coming up November 10th, right after the election, that could potentially actually reverse Obamacare. It would, if the Justice Department wins, the 21 million Americans would no longer be insured, and the vaccine would not be free for them. And you would also not have protections for pre-existing illness. So that's just something to watch on November 10th after the election. All right, so now, how do we know if we have COVID-19? We've discussed this. There's 3 tests: PCR test, antigen test, and CAT scan findings. The PCR test is a nasopharyngeal swab. It's most accurate 8 days after exposure, and it can be inaccurate if it's given too soon or too late. The antigen test is also known as a rapid test. It can be negative 20 to 30% of the time when someone actually has COVID-19. Normally, if this test is true or positive, it's actually positive. So the antigen test, sometimes what we do in a hospital setting, if we want to know if someone's truly negative, we'll actually give the antigen test or the rapid test twice. There are times when people repeatedly have a negative test and we really do believe that they have COVID-19. Then we do a chest CT. And the chest CT actually shows scarring and fibrosis, kind of like a ground glass appearance by chest CT. That's shown in the middle picture in the bottom row. That is what we actually, we know then that that person has coronavirus or COVID-19 as diagnosed by CAT scan. COVID-19 is highly contagious. That's why it really is important that you get tested if you've had any contact. Minimum time of exposure is 45 seconds. If you look at 100 people being exposed to COVID-19, 60 to 80 of them would actually get COVID-19. In relationship to or in comparison to the flu, only 30 or 40 would get the flu. So it is highly, highly contagious, about 2 to 3 times the contagiousness of the flu, and 2 to 3 times also the morbidity and mortality. We know that it is transmitted by droplet and by airborne. It is transmitted by both. That is why it is important that you stay 6 feet away and wear a mask. I've seen some things where people are talking about stay 6 feet away or wear a mask. It's important that it's and. Again, when something is aerosolized, it can hang in the air for a bit. So if you go into an area where someone was there a couple of minutes later, it could still be hanging in the air, similar to measles. The other thing that aerosolizes COVID-19 is a nebulizer machine. So if you live with other people and you have asthma, you cannot tell the difference between asthma and a COVID-19 attack. And so it's very important that you do not use a nebulizer machine or use it outdoors or in a garage with the garage door open, but not in an indoor setting. Because if you happen to be COVID-19 positive, you would then spread it throughout the home. You can also use an aero chamber, which is pictured here to the right, or sometimes it's called a spacer, and that can also be used, and that delivers just as much medication as a nebulizer. Now, we talked about the COVID-19 cluster of symptoms. It's very important that a lot of people forget that COVID-19 can present with GI symptoms, right? So cluster 3 is nausea, vomiting, diarrhea. You don't necessarily have to have a cough. You may or may not have a fever. Cluster 1 and 2 are both flu-like symptoms, and 1, 2, and 3 are usually more self-limiting. 4, 5, and 6 are basically flu-like symptoms, abdominal symptoms, confusion, fatigue, respiratory symptoms. These are the people that actually get more sick, have to go to the hospital, be hospitalized, may go to the ICU, or may actually die. Now, if you found out that you just were COVID-19 positive, so it's important to quarantine immediately. And that is, do not pass go. Don't stop anywhere. Quarantine immediately, preferably for 21 days. What do you need at home? You need a pulse ox machine. That is the most important thing. A lot of people ask me why. That measures your oxygenation level. One thing with COVID-19 is people get short of breath and they don't know they're short of breath. Normally, when you get short of breath, you know you're short of breath. But with COVID-19, you don't. We call it happy hypoxic. Hypoxic is a term which means you're low in oxygen. So we call them happy hypoxics. So it's important that you measure it. If it's less than 95%, then you need to go in. Zinc and vitamin D3, the dosages are all there. That is important really for anybody, whether or not you're COVID-19 positive or not. I'm recommending that people take zinc and vitamin D3 supplements during this time period, or just a regular multivitamin. You want to have access to a bathroom that's only used by you. You want to have your cell phone so you can call for help if you need it. You want to have people leave food at a closed door. You want to keep the windows open and preferably have a HEPA filter or some sort of filter that actually attracts particles. All right, now mask. I've had a lot of questions about mask. It's important to know that the fabric outside, on the outside of the mask, is electrostatically charged and attracts particles like a magnet. So you don't want to touch the outside of the mask. That improves the efficiency of the COVID-19, of the N95 mask. So recommendation is 7 masks, 1 for each day of the week. Hang them up after using them. A week of them hanging will allow for deactivation of the virus. And then you go back to using the following week. CDC recommendation is not to use a mask with a valve. The mask with the valve is on the left. That allows you to breathe out. So if you're asymptomatic and you're COVID-19 positive and you don't know it, you would still be putting COVID-19 particles out into the air. So the best thing to use is the mask to the right with no valve. The other thing that's important is if you cough or sneeze, you should keep the mask on. I've seen people sneeze and want to pull the mask down. The whole point is actually that you catch a cough or sneeze inside the mask. I actually registered for one of these. I'm on the waiting list. I'm actually looking forward to getting it. This is an FDA registered clear mask, which is an N99 active ventilation mask and a HEPA filter. And so they look like they're going to be pretty comfortable. I like the fact that you can still see someone's smile, and also being able to use it over and over again. Neck gaiters, which you see sometimes when people are exercising, have been associated with increasing the risk of transmission. So please do not use neck gaiters. The CDC Director Redfield said that masks may be better than the coronavirus vaccine. Now, this is one thing that was said by this administration that is actually true. So when we look at the effectiveness of two people wearing a mask, the effectiveness is right around 99.5. Some of the coronavirus vaccines have not reached that level of effectiveness in some of the early data. So it is possible that a mask may actually wind up being more effective than some of or many of the coronavirus vaccines. A lot of people talk about the deaths, but I think it's important to talk about the post-intensive care syndrome, which is the long-term effects of COVID-19. We're seeing a lot of renal failure, requiring chronic dialysis or transplant, limb amputations, stroke, scarring of the lungs, which makes it hard for people to actually do their normal activities like house cleaning and walking a block. When you look at young people less than 21 years old, 75% of COVID-19 deaths are Black, Hispanic, and Indigenous people. So this is, some of the health inequities that we're seeing with COVID-19. All right, there's been some talk about herd immunity. Herd immunity is obtained two ways. One, natural infection, where 70 to 90% of the population gets infected, or you get herd immunity by vaccination, and you vaccinate the majority of the population. Now, you wouldn't try to actually get herd immunity by natural infection with this particular infection because the consequences would be devastating. If you assume that 80% of the population needs to be infected, then out of 333 million, that'd be 264 million people catching COVID-19. We've had, with 6 million cases, we had 183,000 deaths. If you had 264 million cases, you'd have 8 million people dead before you would even be at a point where you might get herd immunity. So Sweden attempted herd immunity and actually stopped because the impact on the deaths in the community was just not tolerable. The other thing that makes it even more improbable of getting herd immunity is that we are seeing cases of people getting reinfected with COVID-19. So this is really important because I'm telling people, if you think you got it, or I got COVID-19 already, I don't need to wear a mask. Yes, you do. You need to actually wear a mask. We're seeing this throughout Europe as well as in Asia. All right, a little bit about the vaccine process. So first there's an exploratory phase where you look at how does the infection work? How is it turned on? How is it turned off? Then there's a preclinical phase where you test it on animals. Then you have phase 1, phase 2, and phase 3. Phase 1 is a small group of people where you're just testing the safety. Phase 2, you increase the number of participants and you actually begin to create a randomized trial where some people get the vaccine and some people get a placebo. And then in phase 3, you deal with both efficacy and safety. Currently, our phase 3 trials are with 30,000 participants in it. Then the data undergoes a regulatory review and approval process. There's manufacturing, quality control, and then distribution. Currently, as of September 18th, we had about 50 to 60 vaccines in various stages of approval. One thing is that we went through the exploratory and the preclinical phase with SARS, and SARS and COVID-19 are very, very similar. So we didn't have to redo those phases, and that's why it's actually gone faster. It's important that you go through all 3 clinical phases. This is on my website, and this is 22 case studies where phase 2 results and phase 3 results were very, very different. The vaccine developers have all pledged a joint commitment of safety and standards. They have all agreed that they will not be applying for for distribution until they've actually completed all 3 phases of their clinical trials. There's a German company, Biotech, which says that they think they'll have their coronavirus vaccine ready by December. AstraZeneca, which was working with Oxford University, actually paused their vaccine trials because someone developed an inflammation of the spinal cord. The person lived and was discharged from the hospital. I don't know if there was any sequela as a result of it. And I think that when they paused the vaccine, they did wind up with an additional case of it. So I think they have now 2 cases of that. So that vaccine may fall off the radar screen because of this. Once we do have an effective, safe vaccine, it's going to be important that enough people actually take it for us to actually get some sort of community immunity. COVAX is also working with an accelerator, a COVID-19 Act accelerator. That's CEPI, Gavi, and the World Health Organization all working together. They've basically put together a large infrastructure that includes NIH, biotech companies, regulators, governments, industry, and private nonprofits, the World Bank, to really set up discovery, licensure, manufacture, delivery, stockpile, and delivery of a vaccine. The World Health Organization currently has 169 COVID-19 vaccine candidates that are under development, and 26 of these are in human trials. Now, it's really important wherever you are that you actually kind of know, am I in a hotbed? Am I, what's going on in my particular area or my particular zone? These zones are designated by county. They're designated as green, yellow, or red. You'll see some areas where they also designate an orange. I consider orange and red to be the same. And basically, if you have more than 100 cases per 100,000, or what they say is a diagnostic test positivity rate greater than 10%, so that is basically 100 tests were administered and more than 10 of them came back positive. That's a simple definition of that. Yellow zone is 10 to 100 cases per 100,000 with 5 to 10 cases coming back positive. And a green zone is less than 10 people and less than 5 tests out of 100 coming back positive. So you can actually find this information on www.covidactnow.org. And when some people are looking at whether or not their kids should go back to school, I'm recommending that they find out whether or not they're in a green, yellow, or red zone, and also factor in the age of their kids and whether or not, and who else is living at home. Essentially, if you're not in a green zone, I don't recommend going back to school in person. Now, this is the United States. This is not recent. This screenshot here is from about 3 weeks ago. There are green areas on this map, even though you don't see them. So what they do is they aggregate the counties, but you actually want to click the state and click into your specific county. You can also, in the search bar at the top, actually begin typing in your county. What other countries have done to reopen schools and reopen various things, or they decrease the community infection rate. That's the main thing that you actually have to do. You decrease class size, move desks 6 feet apart, remove water fountains, provide PPE. Part of what we're going to see coming up in the wintertime, as far as the increased rate of infection, has to do with kids going to school and not having all of these things done, as well as having influenza and RSV and other respiratory infections that are going to actually start coming more frequent in the next month or two. It's very, very important, if you haven't already gone to get your flu shot, that you go and get your flu shot, because that is the one thing that you can get vaccinated against. When we look at a COVID risk chart, this was put together by the Texas American Medical Association. Things that are high risk would be attending a large concert, sporting events, going to a bar. Next would be working at a gym, going to a movie theater. Lower would be sending the kids to school or camp, swimming in a public school. Even lower would be attending a backyard barbecue or going to a beach. Next would be going to a library or museum or eating at a restaurant outside. Lower would be grocery shopping, walking, running, biking, or playing golf. Next would be getting restaurant takeout, playing tennis. And the lowest on the list they have here is opening up the mail in your home. Now, I think it's really important that we don't expect life to get back to normal next year, right? If we get a vaccine sometime around the beginning, December, January, or even February, it's going to take roughly about 3 to 4 months to get a significant, maybe even 6, to get a significant amount of our population vaccinated. In the United States specifically, we don't have a very good public health system, and we also have never really done mass vaccinations of adults. Our vaccination campaigns have primarily been children, and then requiring those vaccines for children to actually go to school. I want to actually say that this was a very interesting and important study. This actually looked at what did we accomplish by the shutdown? And I really I think it's important that everyone really get a shout out and a congratulations, because we were all in our homes for several weeks. And they found that overall, the shutdown prevented 60 million coronavirus infections in the United States. That means we literally saved hundreds of thousands of lives. So I know a lot of us, it was a big disruption to our life. I know I didn't like it. I know other people didn't like it, but I just wanted to share with you this study that actually shows what we accomplished as a result of doing it. And in my world, it was really worth it. All righty, I want to actually go to Q&A. A lot of different questions. Okay, here we go. Okay, first question. Okay, do the vaccine people pledge not to get stuff from places like Russia or China? So that's very interesting. So one is for the United States, I haven't seen anyone in the United States talk about getting anything from Russia or China. I did, however, see where India purchased a bunch of vaccines from Russia. No, but I haven't seen anything where in the United States we've been looking at purchasing any vaccines from Russia or China. Alrighty. Okay, the young and the healthy people with COVID-19, are we seeing long-term effects with them? Yes, we are. So a couple of things with the younger folks. We are seeing long-term effects and when I say younger people, I just want to be clear, I'm actually talking about less than 35 years old. Okay, so that's what I call young people. So there's a couple of things that we found with the young folks. So if you're really, really young, like 1 or 2 months, you really do bad with this infection. The other thing that we found is that if you have COVID-19 and catch influenza, or if you have COVID-19 and you catch RSV, and RSV is a viral infection that you see in kids, it causes croup. if you ever had kids with a barky cough, that's usually RSV. So when kids get RSV and COVID-19, they do not do well, and they're more likely to end up in the ICU. The other thing that we're seeing a lot with young people is that there is a tremendous amount of fatigue afterwards. It's taking them a little while to actually get over it. I have a cousin of mine who got diagnosed with COVID-19, and you used to be a professional athlete. And he said that afterwards, it took him almost a month or two before he could really get even exercise. And he's extremely fit. So they're varying degrees. It kind of depends upon a lot of different factors, but the overall healthy ones. And the other thing too is if obesity is another one where someone can be completely healthy, they do not have high blood pressure, do not have diabetes, and they are and they're having problems with it. So in the pediatric study that was done, 75% of the children with COVID-19 were healthy and had no pre-existing illnesses. And of those, about 6% ended up in the ICU and about 1% died. So that gives you some idea. So, alrighty. Let's see here. We've got more questions. Okay. What is the best recommendations for those who are in marginalized communities like homeless and low income? So, it's interesting, this is why I really wish that we had actually just sent everyone masks. I think it would have been a really important thing to send every household 50 masks, and then to also give them out on the street. One of the things that we did with HIV when it came to homeless and low income, we had a whole foot patrol and foot squads that went out to homeless encampment areas, tested, and also came back daily and gave people their antiviral medications. And you really do need that type of commitment, that sort of ground force, to actually work with homeless and low income populations, and even also immigrant populations. There's been a lot of conversations about, should we be providing, there was a lot of conversations before the pandemic, should we be providing non-US citizens healthcare? And one of the things I said on Twitter was that, you can say that you don't want to, but if you had an outbreak of tuberculosis or some sort of infectious disease, you would want people, whether or not they're citizens or not, to be able to get testing and healthcare for free, because otherwise they're going to actually, they're going to give it to other people. And those other people are going to be, some of them are going to be citizens and some of them are not going to be citizens. So it's very important that you decide to actually provide just a basic public health to any bodies that are in your border. Alrighty, let's see here. Okay, so someone asked, your last slide, is this why Trump says that he saved millions of lives? So yes, that is why he's saying he saved millions of lives. And so that shutdown did work. It was effective. I think that the issue is that what needed to be followed after that was not an immediate reopening, a slower reopening like Dr. Fauci and Dr. Birx recommended. And also what needed to be done was to make sure that when we came out of that, we had all of the PPE, hand sanitizer and cleansers that we needed, right? And so I know a lot of people were really struggling trying to find masks. And people were making them, and there was all sorts of stuff going on. So, okay, will incarcerated populations be used for vaccine testing? Very, very interesting. So you cannot use incarcerated people for vaccine testing. So specifically, now, if someone wanted to participate, I think honestly, it'd be hard for them to even participate. But you certainly cannot do it without their consent. And in most situations, you can't do it, period. And usually, they don't even allow you to provide a financial incentive for prison populations, because they are felt to be a population that doesn't necessarily have the freedom of choice that we have. And so the goal is not to use prison populations for vaccine testing. One other thing is that, you also have to have vaccine testing that is done, equally amongst men and women, equally amongst ethnic groups. So one of the things is that I know Moderna had to actually slow down their clinical trials because they weren't having enough minority representation in their clinical trials. And that's also an issue. So you have to have a population that actually reflects the overall population for the results to be applied. But yes, you cannot use prison populations for vaccine testing and experimentation. Great question. Let's see here. Okie doke. Okay, how has the high rate of deaths in the Black and Brown communities affected the trust level of providers in our current healthcare system? That's interesting. I think that, I haven't seen any particular measurements of that. I've always felt, though, that in general, most lower income communities and most Black and Brown communities, my experience with them, so I'm only talking about my experience, is that they recognize that it's not really related to the providers. They recognize that it's related to the overall structure of the system, right? So any particular healthcare system where you attach my health insurance to my job, and my health insurance is not attached to my body, if you have groups that have higher unemployment, you're going to have health disparities automatically, right? Because any population that's uninsured or increasingly uninsured is not going to have as good health outcomes, right? Then I think the other thing that they realize in Black and Brown communities is that, a lot of the doctors' offices are not setting up in their communities. That, some of the old doctors that maybe they had that, went into those communities, the newer doctors are not going into those communities. So, they recognize even whether or not as hospitals that are closing down, they're closing down in rural areas, they're closing down in inner city areas on the poor side of town. And it just makes everything a little bit harder to actually get access to. And that access makes a really big difference, particularly with a disease like this that can be very, very fast progressing. So I don't know, I've never really felt that there's a distrust of us of providers, but I've felt like there's a distrust or there's an understanding that the system doesn't work for them. Okay? So that's been kind of that's just my experience of it. Could be accurate, could not be accurate. All righty, let's see, great questions tonight. All righty, what else do we have as far as questions? Let's see. Rapid testing. Okay, all righty. Yes, so I don't, Mitch, I am going to contact you offline and see what you found out about the rapid testing. And he's specifically asking about the testing that occurs that you have in your home. I'm going to actually make sure that, oh, okay, all right. Oh, let me take you off mute. Okay, you've got information to share with us. Okay, hold on just a second. So let me give people I'm gonna take you off mute. Let me give people a quick background. So, and I'll actually put this slide, Mitch, I'll put the slide back into the presentation because I think sometimes we're always trying to add new information, and we're always struggling with which slides to take in and what slides to take out. But what Mitch actually wanted to provide information about is we shared some slides about a rapid test that you can do at home. And it's just almost like almost how you would check your blood sugar at home, except for it's just a swab of your saliva. And then you put it in this thing, and it actually gives you right away whether or not you're positive or negative. It's dated. So let's say you wanted to go to a play. So this is how they've used it in Australia. Let's say you want to go to a play. Today is the day for the play. I pull out my negative, I show that I'm negative, and then I can actually go on in and go to the play. And they're doing it also for concerts, etc. So Mitch, you have an update.
I do. I looked on the website, and the website said very clearly it was the Yale School of Public Health. They have the test. It's a 45-minute test, but, excuse me, no. It's a 15-minute test, but it requires a lab, and that's the thing, that's the missing. So when you're at an airport or a concert or any large public gathering, you want something that tells you right then and there within a minute or less.
Right.
If it's over a minute, you have people waiting in lines, it's not going to work. People in this country are not that patient.
Right.
All right.
Right.
And
So
I got to confess, I'm one of them. But
right.
but it really, I think what they're doing with the NBA and the NFL is they make it tested every week, every day, whatever. They collect the samples, they ship them to Yale, say to Yale, analyze these samples of our players. They go plunk, plunk, plunk in the lab, and they send the results back.
Right.
This is not what's helpful.
Right.
For
Okay.
us.
So they do not have a test where you can, so they're actually paying for, so this is how I don't know if a lot of people realize. So let me just, you started going into the NFL and the NBA, but I just wanted to just kind of go back to, this is how sports has actually been able to actually play, but play without an audience, right? Is that they've actually been doing this rapid test by Yale, whether or not they ship it from DHL. They actually test the players very rapidly and very regularly and repeatedly. So they're able to actually document a positive test very fast and isolate that person. Right.
Exactly.
And so
that's what I'm
right. And that's how they've actually been able to actually restart the NBA season, the NFL season, etc. Right. Okay, great. All right. So what you found was that they don't have it yet. They don't have it to the point where I can actually determine at home.
That's
if
correct.
I'm positive or negative. Okay.
That's what I saw. And Israel is supposed to have a machine that you can hold in your hand. As I think you said, Australia and South Korea.
Yes.
They're also supposed to have machines where you do not need a lab.
Right.
For large scale, it's just, and you know this, Doc, you can't do it with a lab for large scale, rapid, 30-second testing.
Yeah. You gotta have it where people can actually, do it at home. So it looks to me like the better tests are the one coming out of Australia. So the slide, and I will add the slide back to the presentation so people can see what it looks like. The slide that I had was the Australia one. So I will add that back, and I also will search a little bit harder between now and Thursday for the actual name of that one. And if I get it before this presentation, I will send it out. So thank you, Mitch. All right, great. All right. So what are the possibilities of having testing kits delivered to a home as done in other countries? So this is associated with this question. So other countries have developed more of a home, they have dramatically different testing than what we have. Okay, so they have expanded testing. Some of them are able to actually, you do the swab at home and then you can just drop it off like almost at your local CVS or whatever, and they'll give you an answer. They have just dramatic expansion of dramatic expansion of actual testing capabilities. What are your thoughts on the latest iPhone update, including the ability to aid COVID tracking via GPSs in China? Yeah. So let me just say this is that, you know, we don't. So first of all, we don't have a very good public health system here in the United States. Okay, but we love technology. But sometimes technology is not the best way of doing things. So the iPhone COVID tracking is interesting. However, if I don't have an iPhone or if I didn't download that app, then I'm not going to be contact traced. So it's really important that, you know, New York is doing very, very, very good contract tracing, which is why you've seen their numbers just go down dramatically, right? And basically what they do is they've hired people for $25 an hour. And we had two contract tracers, actually, one from New York and one from Nevada. We interviewed them one week on this program so that people could understand what a contract tracer does and what the work includes. But basically, they call people who've become positive, and they get a list of all their contacts in the last 7 to 10 days, and they contact all of those people and have all of those people who have had any sort of contact with COVID-19 get tested immediately. And if they're positive, they have them quarantined immediately. And so that has been dramatically effective. I think that when you go to the iPhone, it would work, but you're not going to require everyone to download the app. You're going to miss people who don't want their medical information in their phone. It just doesn't have, you have to have really, really tight contract tracing associated with an infectious disease like this. So, oh, okay. All righty. So we have somebody on here that is a contract tracer. I am going to actually take you off of mute. Great. Awesome. Awesome. This is why I love our little community here. I'm going to allow you to talk, Stephanie. You can unmute yourself.
Sure. So now
Okay.
I'm
You're a
unmuted.
contract tracer for whom now?
For Boeing Aerospace.
For Boeing Aerospace. Okay. So you're a contract tracer in a company setting.
Correct.
Okay. All right. So tell us a little bit about what you do.
Well, we, of course, Boeing has an 800 number set up for its employees, and if they suspect any contact with any person who might be COVID positive or a family member and they have been at the work site, they call into the hotline 24 hours a day, 7 days a week.
Mm-hmm.
And once they call in, we call them back and we go through all of the typical contact tracing questions specifically related to Boeing. Have they been near another Boeing employee? Which work site are they at? Which,
Mm-hmm.
which job they perform, how close they've been to employees. And then all of those employees, of course, are rapidly contacted and they're immediately quarantined and secured for follow-up. So
Okay. And then are they doing testing at the job site, or they tell them to go to their doctor and get testing in the community?
Boeing has set up two testing sites. I believe one is in South Carolina and then the other is in Missouri. They're
Okay.
kind of targeting the higher populations,
Yeah.
and then those test results go directly into the Boeing Health Services. So in essence, the company has the results before the
Mm-hmm.
employee even gets them.
Even gets them. Okay.
But it's a 24 to 48 hour turnaround on results with those. But just pilots for now, not
Awesome.
in all of the locations. And of course, everyone else is recommended to either see the virtual physicians via the 98.6 app or whichever app
Mm-hmm.
they like to use to get a virtual doc visit, and
Right.
then follow CDC protocol. We do a lot of education. So a lot of my day-to-day job is educating on quarantine, isolation, testing,
Right.
some of the things
Right.
that you covered here today. So
Yeah. Yeah. Now, you know what's interesting is, and I'm going to add, you guys are getting me to add this slide. I'm going to add this slide back in. We have there's been some studies in the veterinary literature about the effectiveness of sniffing dogs. And they've used dogs that are kind of more friendly and don't look like necessarily like the mean airport dogs, you know? And the dogs have actually been more accurate than the COVID tests.
Wow.
Interesting to sort of know. So, well, thank you. And where are you located? What Boeing location are you located at?
Well, I'm in Arizona, but we work all over the country and even outside of the country because Boeing is international.
Okay.
But most of our tracers are here in the U.S. across the country. So I
Okay.
work with a team of nurses, nurse practitioners, physicians, and we're primarily telephonic, so we can be anywhere and to cover our hotline on a 24-hour basis. So we got 2-hour turnaround on phone calls into the system.
Awesome. Awesome. And had you worked as a contract tracer before you took this job, or did you have a public health background, or did you get trained?
Very interesting. My specialty is actually hospice and palliative care, but
Okay.
I did some triage nursing and found that 3 out of 5 of my phone calls were from COVID positive persons. So I did actively take a contact tracing course myself. And once I uploaded that to my resume and my credentials, I was called nonstop from recruiters. So,
I've actually been telling people, you know, I don't know which course you took, but one of the contract tracers that we interviewed before, they took the John Hopkins course, which was free.
Yes, that's the one I did.
That's the one you did. Yeah.
It is.
The John Hopkins course is completely free. They added it to their resume and had nonstop phone calls for, you know, jobs that were quite well paying. So congratulations for you. Sometimes, you know, there's a lot of sorrow and a lot of pain that comes out of pandemics, but sometimes people even find new pathways and new careers.
Well, you'll find that some of the questions that I asked you today are specifically related to the Black Nurses Association here in Phoenix, who've asked me to present on COVID and how it's affecting our community. So gearing up for some of that, and you've had some great information. So thanks for sharing.
All right.
And I appreciate it.
Thank you. You're welcome. You're welcome. All righty. All righty. Any other questions? Wow, we got a bonus today by actually getting a live contract tracer, and I didn't know that the corporations had actually started hiring contract tracers. So that's actually really good to know. All righty, it's 8:54. Do we have any other questions? Here we go. Okie doke. All righty. So someone wanted to know if I am actually, if I am acquainted with a book on medical apartheid, the dark history of medical experimentation on Black Americans from colonial times to present. Deadly monopolies, the shocking corporate takeover of life itself, infectious madness, and mental how we catch mental illness, etc. Okay, all right. So I'm not familiar with all of those books, but I can actually tell you that I'm very familiar with the history of medical experimentation on Black and brown bodies. That has actually gone back a very, very long time. You know, most people think of it as far as, you know, the Tuskegee experiment, but it actually included a lot more than that. It includes even up to this day. One of the things that was very, very upsetting to me was the physician, Dr. Amen in Texas, that was doing forced sterilizations on people that were in ICE detention. So one of the things that I did was uncovered that he was not board certified. I sent that information into one of our congresswomen that is in charge of the of overseeing ICE, I've been pushing her to have Sheila Jackson Lee I've been pushing her to actually have hearings on that. Because not only is he not board certified in OBGYN, he's not board certified in anything. So that type of experimentation on Black and brown bodies continues. And I think that we have to really be a stand for the things that we see going on in our environments that we know are not right. And we have to be a stand for the truth and exhibit integrity. So thank you for that question. And I have not checked out some of the other things, but you know, there's a lot of books out there and I'm always reading. So, all righty. Any other questions? All right. Well, I want to thank all of you guys for coming today. Oh, one more quick question under the wire. What, will I post the books? Oh, it was a lot of books. Let me see. It was a lot of books. Let me do this. I will, why don't I do this? I'm going to take a screenshot of the books that you mentioned. And then what I will actually do is look them up and send them out to you, Stephanie. And I will actually read it on them and also add whatever I can to the Thursday seminar. So yeah, it's too much for me to actually put in a chat, but I will actually add it to Thursday's webinar and go over what I think about them and add some of that. But the one that was important, the one that I've heard of before was Medical Apartheid, the Dark History of Medical Experimentation on Black Americans from Colonial Times to Present. Okay, all righty. I want to thank you guys for coming. Please make sure to invite people to join us on Thursday. This is an ever-evolving conversation. You know, with everything that's happening now, I am like so proud of this community. I feel like we are the beacons of light for our families and our friends and for other people. We've made it very, very far. The winter is going to be a very important time, you know, to get to March and stay happy and healthy. And I want to make sure that we get the word out to everyone. People are very frustrated now with some of the inconsistent messaging. And this is a place to kind of come and get the facts, and the facts as at least I know them as someone who takes care of patients every day. So I want to thank you guys for joining me. I'll see you on Thursday at 8 o'clock, and feel free to send the invite out to anybody you'd like. Thanks a lot. Bye-bye.